We're not going to get accountability or honesty. Boris Johnson won't even be there today at the press briefing, and I'm told that Whitty and Vallance won't be taking questions. So we are moving into a new phase and a slightly weird period, I think. You prorogue Parliament and advertise your willingness to break international law, and yet you want me to trust you with my children's health, my own health, my mother's health. There's a problem here, isn't there? A real problem. But it's not a problem that is in any way eased or helped by shouting at each other. If we can begin from the starting point that we are genuinely all in this together, you don't get an exemption from this. Even if you think it's a hoax, as some of Donald Trump's supporters in America have discovered too late, it can still kill you. So you start from this idea that we're all in it together. And then you acknowledge the numbers suggest that we're about to be bad again. I think that there are some cautious grounds for a little bit of relative optimism, i.e. that the death rate in relation to the infection rate is much lower. But I would suggest to you that that is itself leavened slightly by the so-called long COVID evidence that is now emerging, sticky blood being a phrase that's probably going to become more popular in the coming months. Many people who were outwardly very healthy when they contracted this infection are still months later suffering from all manner of ailments. I'll tell you now that is it very much in the context of what I do for a living, and I'm sure all my colleagues would agree that is a really interesting well, you'd call it a banker in less cynical circumstances. If you know how we often joke, I think it was Clive Bull's joke originally, that if you can't get the phones to ring on LBC, and this was true in the olden days, it's not really true now, but if you couldn't get the phones to ring back then, which was a thing, it's not really a thing anymore, you would say, is there anybody old out there feeling poorly? Or words to that effect. Now, in the spirit of the stopped clock being right twice a day, if I said now, and I'm not, so don't ring in, if I said now to you that the clocks are right twice a day, if I said now to you that we are going to somehow pull in the same direction, we're all going to be on the same page, I think you'd probably struggle to believe it because you don't know who to trust. And that is where I think we'll begin today. Can we do that? Who are you going to trust? Because I don't think we've got any choice but to trust the chief scientific advisor and the chief medical officer. So I've got two questions for you. And that's not me shouting at you or going, you've got to trust them. That's me saying two things to you this morning. The first is, I don't think we've got any choice as a population. I appreciate they might not be right, or they might not be 100% right, or the calculations that they're making between health and wealth may not be completely transparent. But I don't see how we have any choice. Who else would you trust with this? And that, of course, is where the echoes of Brexit come in. So, for example, you could either listen to the German car industry about what the German car industry was going to do, or you could listen to Digby Pudding Jones. I'd like to think everybody has now learned the idiocy of not listening to the German car industry when you're talking about the German car industry, not listening to Pascal Lamy when you're talking about the World Trade Organization, but listening instead to Andrea Leadsom. We can all see the dangers in this, but that ship has sailed. We'll be dealing with the fallout of that ludicrous period in British history for generations to come. This is alive and now and urgent. And I, as a father, as a husband, as a son, as a brother, as a friend, as a colleague, as a radio presenter, as a journalist, I don't think we've got any choice but to trust the two men that we'll hear from at 11 o'clock today with our safety. I just don't. And I think it's really scary that so many good, wise, thoughtful people listening to this programme right now will already be disagreeing with me. I thought it was fairly clear, fairly cogent, and fairly uncontroversial.
Well, there are many people who will be looking at those numbers, and as you point out, James, there's those two names already next to Sack Vallance and Sack Whitty already trending on Twitter. So there's some people who obviously think that they shouldn't be advising the Prime Minister and the government. The numbers stark. So on the 15th of September, as you said, the new cases was at 3,000 new cases a day. It's already up to 6,000 a week later. So from that graph, you see the exponential rise up to nearly 50,000 on the 13th of October. And then the follow-up number on that, of course, is that by middle of November, that would lead to 200 daily deaths as a result of the new infections from the middle of October. They pointed out the fact that they saw the largest increase in recent weeks in 20 to 29-year-olds, but every age group and every part of the country now, as Professor Chris Whitty said, is seeing an uptick in the number of new infections. But what's stark about the numbers that they were providing was actually between April and the middle of August, the numbers were going down, and it has only taken this short amount of time, the space of 4 weeks, for the numbers to reach a point at which the Health Secretary is saying that we're at a tipping point where if we don't take action now, then the crisis could be so much worse by this winter.
Fair play to Matt Hancock for going into the lion's den this morning, that is this morning, on ITV. But one wonders whether Boris Johnson's absence from the fray is because people would say this reversal, this corner turning, as Chris Whitty described it, coincides precisely with the exhortations to go back to the workplace, and indeed the Eat Out to Help Out. I guess by way of mitigation, it doesn't look at the moment as if the reopening of schools have created a particular problem.
No, and when schools reopened, Matt Hancock was making the point that in actual fact, when schools reopened, that the timing didn't work to see the subsequent uptick in the number of cases. The other defence of linking Eat Out to Help Out versus taking taking a more stringent approach during the course of the summer is that actually the government is saying, and they haven't made this distinction explicit. Well, actually, I think Chris Whitty made it the most explicitly when he talked about unnecessary contacts. So there are social contacts where there isn't any there's no uptick, there's no benefit for the economy. And therefore the government is, and Chris Whitty said there was a balance there, but then there are also contacts where there is a benefit to the economy, such as going out to a restaurant.
Yes.
And what they're trying to do is say, well, actually, on the one hand, if it's unnecessary and there is you don't need to do it and there's nothing to be gained from it, then please don't do it. But Whitty was saying that virus is now rising across the country, and this is not someone else's problem, it is all of our problems.
Yes.
There have been question marks about whether the second wave could be milder. Whitty said that simply it would be great if that were the case, but it is not true. But he did say...
So just to clarify, because I think I may have fallen into this trap, the reason why the death rate relative to the infection rate appears to be lower is probably explained by the fact that the most affected age group is 20 to 29, and they would be the most likely to have a fairly mild case or recovery. So there's no grounds for optimism were the rate of infection for older and vulnerable people to replicate where it was when the death rate was essentially the highest in the world.
The only thing that would mitigate against that, from what Professor Whitty was saying, is that the treatment is now better, that there are new drugs down, but he did insist that that wouldn't be enough to take it down to trivial levels in terms of the mortality rates. So the drugs are better, but it's not going to reduce the number of deaths to, as he described, trivial levels. And he also talked about the indirect impact on the mortality rate, and that the NHS will not be able to, if it is facing a COVID-19 second wave, will not be able to diagnose other illnesses and other diseases as quickly, and therefore we will see an uptick in the number of people dying from other conditions.
So to step back, this was clearly designed to set the scene for the Prime Minister's address tomorrow, which I would suggest, having listened carefully to Chris Whitty and Patrick Vallance, is likely to be quite serious. They're going to be introducing fairly serious restrictions, regulations, rules.
Exactly. So this is a two-part press conference, for want of or two-part way to speak to the nation. Firstly, you've got today, which is, as you say, James, setting the scene, laying out what the country is facing, the grim reality of what the country is facing, and then tomorrow, because of what has happened today, Boris Johnson will be hoping to make the case to justify to people why they need to adhere to the rules, why the rule of six is necessary in England, why, if you flout social self-isolating guidelines, if you're told to self-isolate, you could be in line for a £1,000 fine because of the scene that has been set by Professor Whitty and Sir Patrick Vallance today.
I claim to have listened very carefully, and I think that I did. Did they mention testing and tracing?
No, they didn't. They did mention good progress
I feel
has
you
been
should have
made.
done a dun, dun, dun at that point, but your vocal expression was almost as good.
They did say, Professor Patrick Vallance did say good progress had been made on several vaccines which are now in the late stage of development, and the UK is in a good position for vaccine supply. I'm just going through my notes. We have...
No, I don't think there was either. I mean,
we'll
we'll correct it for the record if there were, but it just occurred to me because I saw on Twitter 3:15 p.m. landed in Iceland. This is from yesterday. 3:45 p.m. tested for COVID. 10 p.m. test results texted with follow-up instructions by email for the second test in 5 days' time. Now, there are obviously many areas in which Iceland is not remotely similar to the United Kingdom, but those experiences which we examined in detail last week from other countries and that is, for me, that's the stone in the sandal, Theo. Why didn't they mention testing and tracing? Because until relatively recently, we were told that there was no prospect of getting a handle on this until the test and trace system was in fine fettle.
In fairness
yes,
to both
always
men,
up for fairness.
Test and trace,
not their brief.
It's not their responsibility. It's the responsibility of Baroness Dido Harding.
I'm going to dispute. I'm going to indulge in a rare argument with you here, because none of this is actually their responsibility in the sense that they have day-to-day control over what happens. They don't run hospitals. They don't get to decide where vaccines go. They advise. They look at the available evidence. And I would say that the absence of the test and trace system at this point in proceedings was a crucial piece of evidence in how we cope with coronavirus. But, we can agree to disagree.
Okay.